Hi, my name is Dr. Justin Dorenzo. I'm a clinical and forensic psychologist and anger management expert. So let's talk a little bit about anger management today. So many of us would benefit from anger management training or simple reminders in how to better manage our anger. Okay? Anger is certainly a natural emotion that impacts all of us. Okay? All of us may go into periods of our lives when we have anger issues. So you go in and out. Often people have not always been angry. Sometimes they have, but they often come in and out depending upon what's happening. So, some of us are prone, however, to having consistent difficulties with anger and managing our anger because maybe we suffer from chronic stress. Maybe we have a really difficult relationship, really difficult job. Maybe there's really difficult high expectations that we're trying to deal with too. And maybe we have a pain problem that really gives us a short fuse. Maybe we're depressed or we're anxious. Often men who have underlying anxiety respond with anger, and as if maybe their wife is trying to get them to do something socially, to be at an event, and all of a sudden they're pissed, they're mad, they're angry, they're yelling. But what's really going on is there's a sense of anxiety. Now, also, anger can be caused because of someone is trying to be perfect. And they're being goal directed and they don't want to be led away from whatever activity they're doing. And again, that's often about anxiety also. And then sometimes there's skewed expectations. Sometimes people with ADHD may just have low frustration tolerance, and other people, also even adults, kids, have low frustration tolerance. And then some people just lack the right level of emotional intelligence or emotional self-management and can't seem to manage their emotions, and then it comes out as anger. Now, why is this the case? Well, some of us had, during our childhood, our parents modeled probably not such great behavior and the expression of anger. And now as adults, we may find ourselves acting like our parents acted when we were kids. So, people seek anger management for all different reasons, but often the individual is not seeking the assistance. They're usually referred by work, or most often in the clinical part of my practice, it's usually because a wife just can't handle it anymore. And she says, if you can't manage your anger, then you're getting out of the house. So that's often why I see a lot of people clinically, but sometimes in my business psychology part of my practice, I see people that are referred from work because they're having trouble managing their anger. Maybe they have outbursts. And human resources is concerned that they need to get help before there's some kind of issue. So again, people that have anger issues often don't come on their own accord. It usually takes a significant crisis for them to get help. So if you think you have an anger management problem, I would get help before your spouse or boss tells you to, or your kids tell you to. I would also try to find a very credentialed provider to service that. Of course, being a psychologist, I think that we're best equipped to manage that. But you want to make sure that somebody is credentialed when you are seeing them. So we do offer anger management at our practice. We offer it in an online format. We have a 4-hour and an 8-hour course, and a lot of people that get to even take that course are people that are court ordered, or people whose spouse says you've got to do something about your anger. But if you think you have a problem, you may want to take one of our courses, or you can certainly contact our office and see somebody face-to-face if you're in the North Florida area. If not, we're happy to see you on Skype or talk to you by telephone. It's really up to you, or find somebody in your area. So if you have any questions about what we do, first I'll tell you we use a lot of cognitive behavioral type strategies, and I'm going to talk a little bit more about those, but what we use a lot of all of our interventions are evidence-based type practices or evidence-based type interventions, meaning there's a lot of science behind them. They're proven techniques to help you manage your anger. So if you have any questions, please peruse our website. We have a lot of information there. Or you're certainly welcome to contact us or email us. And just come to our website. We have all that information, all those contacts. So best of luck to you. Thanks.